To silane or not to silane a veneer? That's the question. No, you don't need to use silane. Silane does enhance the bond strength, but it's not necessary. If you've ever had a veneer come off, which occasionally it may happen, the luting composite is always on the veneer. It never stays on the tooth. So there's plenty of retention on the veneer without the silane, and the silane can serve as a contaminant if you don't use it correctly. It needs to be a certain temperature, mixed a certain way, not outdated. I want these procedures to be simple, efficient, and work every time, and you don't want to add a procedure that can cause contamination and cause the procedure to fail. So this is a veneer that had come off of a tooth. In my practice, I think the veneer had been, I don't know how long this patient had had the veneer or where it was placed, but you can see the composite, luting composite, is still in the veneer, and that's always the case. So this case demonstrates how strong the veneer luting to the tooth is without silane. I did not use silane on this case. I've never used silane, and look how strong these veneers are. I was replacing this veneer because it had one little dark spot that I did not like. So look what has to happen. This veneer was luted with the technique I've taught in Dentistry Master Classes, meaning the tooth was etched with 38% phosphoric acid, rinsed, then primer adhesive was placed on the tooth and the tooth side of the veneer. The veneer was etched previously with 8% hydrofluoric acid and then placed in an ultrasound to get rid of the chalky layer. But the primer adhesive was placed directly on the tooth and on the tooth side of the veneer, and that's it, no silane. So I'm removing these two veneers. Now look at that little bitty layer of restorative material of porcelain on the tooth. As I continue to remove, none of it chipped off. That little tiny thin layer remains on the tooth, and none of this ever chipped off. So here I'm removing. This is still on here, got a little layer right here. This is how strong this bond is. In my opinion, veneers are as strong as teeth. If you use this technique, nothing will happen to a veneer that would not happen to a normal tooth. Can you break a veneer? Sure you can. You can break a tooth. If you bite down on a piece of beef jerky or taffy and hit it wrong, you could break a veneer, but the veneer is not going to come off the tooth. It becomes like the tooth. So this is after I've removed all I could, and you've still got little bits of the luted veneer on the tooth. So you do not need silane. You do not need silane. It can serve as a contaminant. And that's the Dental Minute. These techniques work, and they work every time.